Hello, everyone, and welcome to this week's Coronavirus Booster. I'm Elizabeth Demmings, the Institute for Food Safety at Cornell University's Coordinator and Extension Specialist. Today, I'm going to brief you on the current status of vaccinations in the US, the impact this has had on the number of COVID-19 cases, and where we are globally in the pandemic. Then I will make a few remarks about the new CDC guidelines for fully vaccinated persons and what that means for food manufacturing and retail establishments. So nearly half of the US population has received at least one dose of the vaccine, and nearly 40% are fully vaccinated. And remember that there are many benefits to being vaccinated. As a reminder, anyone who is 12 years or older in the US is now eligible to receive a vaccine. If you are not vaccinated, you still run the risk of becoming infected with COVID-19 and getting a severe illness. And you can also still spread COVID-19 to others. So as you can see on the next slide, vaccinations are really making an impact, and COVID-19 cases have started to fall nationwide. So we can see, based on the 7-day average of COVID-19 cases, or that red line, that cases are continuing to fall in the US from the peak that we experienced back in January. And this is again largely in part to the massive vaccination efforts across the US and the very highly effective vaccines that were given emergency use authorization by the FDA. Now, despite the fall in numbers of cases, it's still really important to note that we do still have 27,000 daily cases of COVID-19 here in the US. So if you're not fully vaccinated, look into getting that vaccine for yourself. Also, we are still very much in the midst of a global pandemic. Overall, across the world, we are seeing a decrease in the number of cases of COVID-19, which is great. However, there are still some hot spots as indicated in this global map. Although cases are going down across the world overall, India has the highest number of daily counts. It's really close to what the US hit with daily cases during our peak in the winter. So they have over 220,000 daily cases, or a 7-day average of more than 250,000 cases. And there are neighboring countries like in Southeast Asia, like Nepal and Malaysia. They're also experiencing a peak in cases right now. And in addition to Southeast Asia, South America is being hit really hard right now, especially in Argentina and Uruguay. These cases are increasing actively across South America. So globally, our vaccine distribution and administration has not been as widespread as what we see in the US. If you look at this bar graph on the left, it indicates that the total number of fully or partially vaccinated people in the world, comparing the US to North America, Europe, South America, Asia, and Africa. North America is by far leading vaccinations. And if you look down to Africa, that bottom bar has the lowest, with less than 5% of its population being fully or partially vaccinated. And this really indicates the growing disparity of access to vaccines between our high and low income countries. So you can see here this graphic published by the New York Times World COVID-19 Vaccination Tracker. It illustrates vaccination rates by country based on their income. As you can see quite clearly, high income countries like the United States have a significantly higher vaccination rate compared to these low or medium income countries. So we are still in this for the long haul. And there are some estimates that indicate that many of these low-income countries won't have access to vaccines and won't be able to be fully vaccinated until the end of 2022. So with that being said, take advantage of the vaccine access that you have here in the United States, get vaccinated, and help make your impact on reducing the number of cases of COVID-19 across the world. So I also want to touch base on the new CDC guidance that was issued earlier this month, updating previous recommendations for people who are fully vaccinated. And this includes updated guidance on wearing face coverings and practicing physical distancing in indoor and outdoor public private settings. So for fully vaccinated individuals, the risk is very low of getting COVID-19 or transmitting it to others. So as a result, Fully vaccinated persons can relax the implementation of prevention measures, such as wearing face coverings and practicing physical distancing when they're indoors and outdoors and around other people. However, this new guidance does not apply to unvaccinated individuals. Unvaccinated individuals should continue to wear face coverings and practice social distancing because they're still at a high risk for getting COVID-19 and spreading COVID-19 to others. There are also several exceptions stated within the CDC guidance for these fully vaccinated persons. I would like to go through those next. First off, fully vaccinated immunocompromised persons, as well as those individuals who are on immunosuppressive medications when they were vaccinated, should consult with their healthcare providers about whether or not they need to continue following these preventive measures. So when they were vaccinated, they may not have mounted a robust immune response, and so they could still be susceptible to getting COVID-19. So they need to check with their healthcare provider to see what is best for them. Second, there are specific settings where fully vaccinated persons still need to wear face coverings. And examples of this include on public transit. So like when you're on airplanes and airports, if you're on buses, trains, subways, boats, or ferries. There is also still a requirement to wear face coverings in both homeless shelters and correctional facilities or detention centers. And then thirdly, the CDC is providing guidance. So you must follow and continue to follow your specific state and local regulations. So what does this mean for our food facilities? So you most importantly will need to continue to comply with your state and local regulations. Don't forget to follow these. These are the rules that you have to go by. Second, you're going to be facing many challenges as you decide what to do with this new and emerging change in the guidance from the CDC. So here are some of the examples of challenges that you're now going to be facing. So do you still want to require your vaccinated employees to follow the prevention measures that you put into place, like wearing face coverings and practicing social distancing at work? How are you going to verify that your workers are fully vaccinated? What happens if you have a mix of fully vaccinated and unvaccinated employees? Your unvaccinated employees are still going to need to continue to follow these prevention measures, as the new guidance really only applies to fully vaccinated employees. What happens if you have immunocompromised employees, even if they're fully vaccinated? So how would you continue to monitor and verify within your facility that these COVID-19 prevention measures are being followed if you have a mix of these types of employees? And so what it really comes down to, the bottom line is that you're going to need to do what's best for your operation and your circumstances. So our plan for the next couple of COVID-19 boosters is we're going to help you try to address some of these new challenges that you're going to face as more and more of your employees become fully vaccinated. And with that, I would just like to acknowledge our funding from the USDA NIFA AFRI. Thanks and have a great day.